Welcome back to Module 3, the relationship with providers, the second part of the three components of the client's experience. Our client's relationship with our service providers are another significant part of their experience, as well as the family van's model of care delivery. Whether a first-time client or a client who has been visiting the family van weekly for years, many of them describe interactions with service providers as a key piece of their experience. These relationships include what providers do, how both providers and clients interact, and how clients feel as a result. Clients describe that on the family van, providers communicate in plain language, are honest, encourage them, show caring, listen, provide emotional support, show physical affection, occasionally discuss religion, sometimes self-disclose, understand the community, and make them comfortable. Clients frequently noted that while receiving services, it was valuable to them that family van service providers communicate information about their health in a way that they could understand. In talking about how family van providers communicate to him during his visit, one man said,
"They explain things very well. They make it plain, simple, and straight to the point, so you can understand."
In contrast to her physician, another client commented,
"They explain things on the van, and my doctor doesn't really explain stuff to me."
Clients also appreciate the honesty of service providers. One client saying,
"They're very honest. They'll say, 'I think you need to do this,' or 'I think you need to do that. I can't make you, but I suggest that you do this and do that. That's how I originally found out that I had cancer."
Clients mentioned how they felt encouraged by providers on the family van. One client described that,
"What most caught my attention was the young lady who talked to me. She looked like she was really into helping people. For a minute, I thought I was going to go away. I thought, I don't have time for this because I'm in the middle of doing other things. But the way she talked to me encouraged me."
Clients also felt that providers really cared. After a question about whether his health had changed since visiting the family van, one client responded,
"My health has been improving with the reading of my hypertension and diabetes. To be honest, it's because they care about us."
Clients described how providers listened actively and even provided empathy when the case called for it. One client said,
"When I tell them I'm depressed, they feel bad for me, and I'm depressed a lot, and I feel better when I leave."
Or they provide physical affection. One client commented,
"They get along with me, and I love them too. When they see me, they give me a hug, or when they don't see me, they ask, 'Where have you been?' And I say, 'I miss you. I love you.'"
When appropriate, providers sometimes discuss religion with clients. One client recalled,
"The personalities, the people on board are somewhat folksy, somewhat religious, overly so sometimes, but nevertheless, I find that to be charming and very much consistent with my heritage in Southern African American male."
or self-disclose information to create a relationship with their clients. As one client exclaimed,
"Oh, I love all the staff. Since day one. I admire them so much because I got kids too, you know."
Their children were often a subject of conversation between this client and several of the service providers. Related to all these qualities are the family van service providers understand the community. Many service providers are from the community, and for those who are not, The staff receives cultural competence training. In addition, service providers learn each client's unique social and economic context, cultural beliefs, and behaviors. As one client described,
the staff understands the people. They relate to the public. When you're in the community, you understand the community. When you're not in the community, then you really don't understand the community. You don't know what words can affect them, how you can say things that can affect their life.
Nonetheless, one of the most important factors is that the providers on the family van make their clients feel comfortable. As one client commented,
"They make you feel comfortable. That's why I like coming here."
In contrast to her doctor's office, another client stated,
"In the van, I'm more comfortable. Even though I've known my doctor for 23 years, I'm shy with him."
Between clients and providers, these interactions also feature admiration and respect, humor and fun, and shared decision-making. While interacting on the van, both clients and providers feel the admiration and respect for one another. One client remarked,
"They treat me really nice because they treat me with respect and they admire me. I admire them too. I admire them a lot."
Thus, the admiration and respect is often a mutual phenomenon. Both client and providers also participate in fun and humor. One of the clients said of the staff,
"I think they were great. Very nice, smiling, outgoing. They're not shy. They crack a joke, then you crack a joke. This is business, but at the same time friendship. You know, it's fun."
During the interactions with providers while receiving services, clients noted that the decision-making was also shared. When asked who she felt makes the decisions in her health care while on the family van, one client responded,
"I do. I make the final decision, but the service providers on the family van give me the insight on making that final decision. They give me the information."
In fact, clients control all of their health care encounters on the family van, from when to come to which screenings to do. Following the knowledgeable neighbor model, service providers act as a friendly support system to clients in making decisions about their health. As a result of these interactions, clients feel that they can speak freely, asking questions, and have anonymity. One client described,
"We can talk, we can speak freely."
which contrasted with another client who described,
"My doctor is amazing. I love her. But I know I went to other doctors and I didn't feel as comfortable. I didn't want to talk to them openly."
Furthermore, clients feel that they could ask questions. One client commented,
"I feel comfortable answering questions and asking questions. They let me know that I can ask questions. They say, you know, you can ask us anything. We're here to help you. If I can answer them, we will. If I can't, we refer you to somebody that can." So it's the way they go about it that makes you feel comfortable, even if you are uncomfortable.
The anonymity of the clients felt while on the van was also a significant factor in these feelings. One client described,
"I get to just put it all out on the table. It's so anonymous that I'm comfortable. I can say, this is what I'm dealing with. This is what's going on. Boom, let's go."
Clients characterized their relationships with providers in many ways, including that they were easy to establish, equal for everyone, and consistent between visits, personal, informal, yet professional, and like a friend or family. One client noted that establishing a relationship with providers on the family van was easy. Another described that despite the turnover of volunteers,
There's been a lot of different workers I've built rapport with over the years I've been coming.
many clients cite long-term relationships with providers over the time they had visited, from a couple of times in 3 months to weekly for 5 years. Some clients mention how the family van treated everyone equally and consistently.
They don't care what you look like. They don't care what you dress like. They don't care what you smell like. You're always welcome in.
I think the family van is great with everybody. That's why they have so many people there. You can be black, white, you can be Spanish, or you cannot be Spanish, and you could be, anything, and they still have the same respect for everybody.
Some clients emphasize how the family van was a personal experience for them. In comparison with his doctor's office, one man observed how
The family van is more personalized. I feel like it's about me. I'm not a number, I'm not a chart, and I'm not sitting down with a million people.
As one client described, the family van maintains an informal yet professional relationship.
The relationship is like a professional relationship, to the point where I can come on the van and they'll know who I am. They'll know exactly what it is that I need and what I'm going to be asking to get done.
However, at the same time, the clients described the family van felt like a friendship or like their family, without the hierarchy that is often present at a doctor's office.
After a couple of visits to the van, we have established a friendship between us, so I feel free to tell them anything that is wrong with my health.
Oh, it's very pleasant, very comfortable. You feel like when you go there, it's like seeing your family.
The interactions and relationships with the service providers is a big part of how and why the clients improve their health after visiting the family van. As one client suggests,
I think people in the neighborhood will develop a closer relationship with the staff on the family van so that they'll feel more comfortable talking about things and getting more health conscious.